Wilderness First Aid, Bleeding and Wound Care.
Oh,
Hey, are you okay?
Yeah, I was thinking about my elbow. I didn't see the rock. I was looking back at you.
Open wounds are among the most common injuries seen in the wilderness. Most are minor and are of little concern.
To care for a wound properly, you must first control the bleeding. First, protect yourself against disease by wearing medical exam gloves. If they are not available, use several layers of gauze pads, plastic wrap, or bags, or waterproof material. If necessary, have the person apply pressure with his or her own hand. Use your bare hand only as a last resort. Expose the wound. Remove clothing to see where the blood is coming from. Avoid excessive exposure in cold environments. Most bleeding can be controlled by applying pressure over the bleeding site. Clean the wound to reduce chances of infection, even if cleaning may restart bleeding.
For a shallow wound, wash the skin around and inside the wound with soap and water. Flush the wound with pressurized water that is clean enough to drink.
Some wounds, such as bites, very dirty or ragged wounds, and deep punctures, have a high risk for infection. Clean these types of wounds as best you can. If available, apply a very diluted iodine preparation, such as 10% providone iodine. Undiluted iodine preparations are painful and kill body cells as well as bacteria, which can affect healing. High-risk wounds require medical care. Evacuate as soon as possible. For all wounds, watch for infection occurring hours or days later. Signs include swelling around the wound, redness, pain, and pus.
To remove small objects not flushed out by irrigation, use tweezers sterilized with a match flame or alcohol. Hold the tweezers over a flame for about 20 seconds. Allow the metal to cool before use. For an abrasion or shallow wound, apply an antibiotic ointment. Cover the wound with a sterile or clean dressing. It is important that the dressing remains clean and dry. Keep it in place with a self-adhering roller bandage or tape. Change the dressing if it gets wet or dirty.
Here are some common mistakes in wound care. Do not use hydrogen peroxide. It's a poor antiseptic and it adversely affects capillary blood flow and healing by drying out the wound. Do not soak a wound to clean it. Do not close a wound with tape. Infection is more likely when bacteria are trapped in the wound. If a wound requires closure, this should be done by a healthcare provider.